Welcome to another episode of Stories from the Edge of Life. We have another great guest, or guest we've had before, Dr. Gil Naco. Welcome back, Dr. Naco.
Hi, good morning.
Good morning. Would you mind introducing yourself to our audience once again?
So I was one of the first people ever to do a palliative fellowship in the United States. And I started at San Diego Hospice and been going ever since. It's been 25 years, actually, since I first started seeing people at the end of their lives. So it's been quite an experience, so much to learn. It's really been a rich experience, I would have to say. Yeah.
Great. And I'm Parag Bharadwaj. I'm also a hospice and palliative medicine physician based in the US. So, Dr. Naco, last time we spoke about your medical journey and what got you to become a hospice and palliative medicine physician. This time, we want to learn a little bit about your take on life and what you've learned from the various experiences with patients and their families, and your own observations and perhaps your own experiences as well. So, what is life all about?
Well, that's a big question. I don't know. I mean, I could speak for days about it, but really, as I've gone on in this experience of being a physician, the thing is, there's always another layer. There's always another layer to peel off the onion. And that's what makes this, in a way, I think, the only way I could have been. I'm exactly where I should be. This is what my set of experiences has set me up for, and I'm just sort of riding the wave. I think last time we talked, I talked about the setting of how palliative medicine, what it kind of arose from, at least my take, from not being very well known, and to tell you the truth, not really well accepted. I remember doing a grand rounds at the Balboa Naval Hospital, and I basically, I'm this quiet guy, like I keep saying, but and you may not agree the way I'm talking right now, but I was basically attacked by the medicine and surgeon, sort of like people who were there as I spoke about withdrawal of hydration and nutrition and things like that. People thought it was like, there's a big, it was a big subject back in the day. And now palliative is mainstream, which is like, it's I don't have to defend what we do. It's an interesting, what's happened over the last 14, 15 years. So, so to me, and we were speaking about this before, the human experience really, it really is all about love. It really is. I see people who are passing away all the time. And so one of the things that I have that isn't common in, at least in California, is I have an inpatient hospice. I have 12 beds, sort of like half the San Diego hospice contingent. And I just get to sit with people and learn. They tell me things, and they, like as we were speaking before this interview really started, I get to be a witness, and in that role, I learn more and more, and what you see is there's so much tremendous love. It's this experience of knowing that the time is short, that you don't have a lot of like I said, time with your loved one that makes it such a rich part of life. You know, there's a lot of stress, there's so much emotion. Um, but when you're sitting with them and then you see the families and how much they reach out, and at least at my place, you know, I let people, like at San Diego Hospice, I let people stay 24/7 up until the COVID crisis, and now it's happening again, and it's it's humbling uh, to see how much love there is in humanity. It's not all like what you see on CNN. Um, you know, the wars and things like that. There's this side of humanity that is uh, very nice to see, and that's what I live in, is this environment. Um, yeah, behind the scenes, there's a lot of, you know, fighting to keep the unit going, and a lot of problems like that, funding, and hoping we can get staff, and then training the staff. Um, but it's all for this purpose of basically just helping people through this time that, for me at least, is my purpose in life, and that is my meaning, is the experience of life, of the uh, things that what you get reminded of every time you see another person in one of these loving relationships, um, is just how precious our time is, and you know, the fact that you have to savor every minute, every moment, every experience. And I keep saying the word experience, but that's exactly to me what is the best word to describe it. There's so many um, nuances. There aren't words for all the things that I've learned, really. There's too many. It's so nuanced. There's so many, like I said, there's layer after layer after layer that are available to the human mind to um, extract. It's just a kind of, it's a privilege to me. A lot of the physicians I work with, you know, they're great cardiologists, they're great surgeons, and they're really good at their craft. But for me, my craft is people, and uh, first maybe trying to get a little understanding of them, and then maybe pointing away. After all these years, I have seen a lot. You know, as we spoke of in our first interview, it's my dog. Sorry, he's he is a vicious Labrador, but he but lost my train of thought there for a second. But oh,
It's okay. It's okay. We'll come back.
but so yeah, no, I mean, that's the thing, is you see all these, you know, these, like you said, story after story, and that's in a way that's our way of thinking of things, is that we're part of this story, and we're kind of the protagonist of our own stories, and the you can get so much out of it. Each person is a hero in their own way. The way that they took care of somebody, the way that they nurtured somebody, you know, the way that maybe they let somebody down, but now they're trying to make up for it in the last few moments. So yeah, it's just a privilege to be able to do this. Oh yeah, no, so yeah, that my skill is not a cardiac cath. It's not, you know, seeing every nuance in an EKG but it's sort of just being a regular guy, just a regular person who can be really quiet and listen. And if I do get something to say, if something pops up, I can point somebody in a direction, hopefully, that will be helpful. So.
Thank you. Thanks for sharing that, Dr. Naco. Do you recall any specific patient/family scenario that was like an aha moment for you that, hey, this is what it's all about? Or did you come to that realization over time?
I think that you see so many. They kind of just, maybe it's just old age. They're sort of starting to become one big blob. I can only speak to with detail on my more recent experiences, and because like I said, it's been year after year of trying to learn to be a good listener and trying to be a good witness and trying to hear what the person is trying to say, and just trying to be there, as we were talking about, with the presence is such an important part of this time that we have with our with our people. So the one that really comes to mind lately, and it's because it is sort of like another young breast cancer patient, and we talked about Linda, my fiance, before passing away of breast cancer. In a similar way, there was this lady who in her early 30s, with her primary care doctors and even the initial oncologist poo-pooed the fact that you're too young to get breast cancer, sort of a thing. It's not, the mammogram is not indicated. And then, by the time it was found, it was already metastatic. It was like pleural effusions and bone mets in her shoulder and things like that. So it was just that this lady, and she was a fighter. And she, one of the things that really stood out for me in her experience was that she always had to get up to go to the bathroom. And you don't really think about it, but since you're 3 years old, you're being, potty trained. And then, like, for her, it was like such a huge dignity issue. Even when it took a ceiling lift and 2 nurses, and it was like this huge production for her to get up into a potty and pee or have a bowel movement. Even though, I think my nurses hate me because I would drive them to, like, no, you got to do it. This is a dignity issue. Come on, what if you were in this position? It's one of the things I really remember. She until she passed away, really until the last 2 days of her life, she insisted on getting out of bed. And one of the things that was good for her, in my estimation, is that the COVID crisis had started to ease, and her mom would stay with her 24/7. And again, so this is just the experience that I witnessed, and the great love, even though they were always at each other's throat. It's like, that everybody's love language is so different, but they would go at it, and, like, the daughter would try to even, like, throw mom out of the room and things like that, and we'd have to deal with, like, the peacemaking, and it was but mom had to be there, and she was there even when she passed away. I think um, it's something that you again makes you have faith again in humanity. If you're somebody who only watches the political drama and the wars and things like that on TV. So the the other part was, yeah, her dad was always there too, and I think maybe like I said, you remember the younger ones just because it's the opposite of what we're usually seeing. We see the mom and dad still being mom and dad, instead of uh, the child becoming the parent and the caregiver and things like that. It's um, very interesting interaction that I saw, and she was there for months. That's one of the nice things that I've cajoled out of the leadership. Although, like I said, it's always a fight. Is utilization review. I've scared them away. I'm smiling right now, but I'm really mean at heart. So I can really be a vicious fighter. I'm a big brother and the eldest son, so I will go to the mat for the people who I'm in charge of, or supposed to be fighting for. And the other. So I don't know if the other case that just happened very recently, that I actually reversed the DNR, which is really odd, and I don't know why. It's this man was in his 50s. He's a guy who was actually so the true title of my little hospice, my little 12-bed unit, is a palliative unit. So about 20% of people are there for pain, and then they go home, or nausea, vomiting, and then they go home, or severe itch because of their cholangiocarcinoma or something like that. So this guy was supposed to be one of those guys, and he was there mainly for side effects of his chemo. So I see a lot of mucositis, and I just read a paper on some novel ways to treat mucositis, which I'll never get approved through my pharmacy committee, but whatever. The So he had really bad mucositis, and he had a mass that was shrinking because he was while he was on my floor, he still got and this is like they'll probably get pissed off at me, but I was allowing chemotherapy to be given and radiation to be given while he was in my unit. He was there for basically the last 6 weeks of his life. He never really it was just he had his again, the fighting nature of just the person. He was the chemotherapy and radiation were really knocking down his energy. And this is a guy who taught ballroom dancing for a living, and his wife said, "Yeah, when he gets better, he'll teach you guys dancing." And it was my sort of dream that he would sort of pull out of it and teach me and the nurses how to tango. So it's like, I don't know, whatever, romantic. That's me. But the thing is, yeah, to be on my unit, just like at San Diego Hospice, you have to be DNR and DNI. But what happened was he had a sentinel bleed, and he bled and bled. And I've seen it before. People bleed out from head and neck cancer, but not to this extent. He was literally drowning in his own blood. So his tumor had eroded into his right internal carotid and jugular vein, one or the other, probably, probably arterial, because it bled fast. And I just got scared, not scared, but you just want to do something for the guy. And he was, like I said, he was drowning in his own blood. So we did intubate him for airway protection. And it's the first and only time that in 15 years at the VA that I've reversed the DNR. And that was interesting. I've been questioned a lot by the higher ups for that, but it just seemed like the right thing to do at the time. So, it's something that I knew it was probably going to be useless, but he did get intubated, and by the time he got intubated, he had already suffered from anoxic encephalopathy. So we had to have the discussion again with the wife, but it is like I said, it's like the experience of life. You can't always make the right decisions. I don't know if that was something against integrity, which is like a huge tenet of me and my experience. You asked what was life to me, and to me, it's a lot of it has to do with integrity. So this is building of your value set, character, which is like basically what you do when nobody's watching, and then fulfillment of your abilities, basically, like living up to your potential if possible. These are things that are things that I've just gotten out of what a lot of the people who I've spoken with over the years. And also, my family, my mom, again, she was the biggest love influence of my whole life. And that's why love is so much in the forefront and what I try to look for in other people. And then, my grandfather was like this strict disciplinarian, and he was the guy who was this, he's really big on values and, like living to your potential, giving it what you, all you have so that you can, reach something that you didn't think you could do. So, anyway, so that's my random sort of tangential rant about, at least for today, what life is.
Thanks for sharing that, Dr. Naco. And I know it's not easy to open up, and it takes a lot of courage to come forward, and be a guest in for such an interview. So thank you. Just for the sake of our audience, because some good number of them are international, DNR means do not resuscitate. Yeah. So
All
just making sure they knew it. Now the thing is, what I really liked is you mentioned the many layers that need to be peeled off, right? But you got to the core in terms of what it's all about. So that is, I think, the beauty of what we get to witness. And if you hear the interviews that we've conducted so far, there is a common theme, and it's for people to pick up what that theme is. But I think you've sort of given a good direction as to where it all heads.
Like I said, I'm usually really quiet, and a lot of it has to do with the fact that I know that there aren't words to explain those, as you said, aha moments. I've had aha moments, and I try to journal and figure out what exactly It is, but when you start to write it down, it's just, you fall short. It's almost too big for the English language or any language, really, I would say. So.
Oh, that's really powerful. Thank you. Thank you for sharing that, Dr. Naco. And I think that'll be a perfect conclusion to our discussion today.
Yeah, sure. Anytime. Yeah, if you want to
thanks
talk,
a lot.
you know.
Yeah, I would love to have you back. I think there are a lot more layers we could peel together in our discussions.
It's been 25 years of building up layers or peeling off layers, and if I can remember enough to make it interesting and that people want to listen to, that's the thing. It's you know, like I said, I read a lot, and there's no way a lot of these ideas are all mine. You know, I'm borrowing, and then, you know, maybe adding a little bit of my own.
But yeah, at the end of the day, your experience is your experience, right?
And yeah. Nobody has this experience and has seen. Like I said, I kind of, you know, I'm just maybe obsessive compulsive about trying to become, trying to learn more, and to me, okay, so this is one of the big things I want people to realize too, especially the trainees, the UCSD residents that come with me every month, is this medicine thing, because it has to do with people, is an art. And it's just like, you know, for me to try to explain it is just, because it's an art, isn't going to give justice to it. It's much more than you know, knowing exactly what medicine to give, and you know, it has to do with listening to the person, maybe trying to not judge, but figure out a little bit about what they're all about and what they're trying to say, and then after that, you know, trying to guide them, because it is a short time that they have and their families have together. So but in the end, yeah, no, we all know what's going to happen, and so again, just enjoy it as much as you can, and like try to find something that, you know, if learning is how you enjoy it, then that's, you know, that's a thing too. So, or at least trying to figure things out. So.
All right, perfect. Yeah, it seems like, so in conclusion, what I heard was that medicine is not just science. There's a lot more to it. It's a combination of the science and the art of that needs to be practiced. And so I think we'll conclude with that, Dr. Naco, and we'll love to have you back again.
Okay. All right. Thank you.
Thank you very much.